Hi, my name is Camilo Andrés Morales Jimenez, and with my partners Jerónimo Lora and Juan Pablo Pavón, we are going to present you the genetic disease that is the muscular dystrophy disease of Duchenne. First, we have our genetic card. Our genetic card is about this case, and we have a little description about this case that my friend Juan Pablo will give you in a little moment in the methodology. And also we have the information of the patient. First, our patient is a little boy of 9 years old that is called Andres Rodriguez Garcia. He presents a weakness in the development, in the muscular development. Also have difficulties to move, and in the history he presents a retard in the muscular development, and in his family there is no history about similar diseases. Also, we have a little illustration about this disease, and finally we have the variables. First, we have the dependent variable, that is the symptoms of the disease, the independent variable that are the disease and the mutation, and the controlled variables that are the environment that the kids have, the care that receive the child, and the history, the family history of the child.
Duchenne genetic muscular dystrophy is a progressive genetic disease that makes the muscles break down and replaced by the fatty and fiber muscles. It causes that the weakness on the body and the difficulty on the walk. The muscular dystrophy may caused by the mutation of the dystrophin gene, causing that the protein cells can repair the damage on the muscle cells, and also if the symptoms cause between the 2 and 5 years old, causing the weakness on the walk and also the general weakness on all the body.
Qualitative data were used to measure epidemiological effects such as age onset, familiar incidence, and also survival rate. This helps us to identify patterns and also the evolution of the disease. Also, muscular biopsies and genetic testing confirm the absence of the mutation of the dystrophy. This helps to understand that is not evolving the dystrophy to a bigger thing. This and also assisting weekly to the appointments to have secure that is not evolving too much the dystrophy. Finally, we use techniques such as MRA to provide visual representation of the muscular progression of the patient.
We have two data of the muscular dystrophy, that is the quantitative and the qualitative. The quantitative is that collect the assessment of muscular strength, mobility, and respiratory function. This data is able on tables and in the graphs. And the qualitative is the family testimony and the observations collected by them, like the emotional impact, the social support, and the treatment adherence.
The patient shows progressive muscular weakness in the limbs and have difficulties in activities like running, climbing, and other general physical activities. For the other hand, the respiratory capacity remains stable, but he presents fatigue in prolonged physical activities, leading to incorporate a stretching lower impact exercise program. And for the other hand, the attitude of the child is positive, while the parents presents a frustration and sadness.
Okay, the conclusion. we conclude that it's important to know what is in the life of a 9-year-old with Duchenne muscular dystrophy. Also, we conclude that all the investigation, all the treatment that was given to the 9-year-old patient was necessary to understand what is happening and to the things that he will pass in the future, the exams that he will have in the future for his Duchenne muscular dystrophy, his examinations of the doctors, and for the historical clinic for the 9 years old with the dystrophy. Also, to understand how the quick action of the doctors, of the massagists, of the physiotherapists, of the psychologist of the 9 years old boy was necessary to develop a good the illness that he have, and to not have a huge development in a short time of the dystrophy, and also to have the knowledge what is the dystrophy, how we can examine and collect data about the dystrophy, and also to see what the patient suffers in the treatment. Okay, and the thing about it of this study is also to study and the development of the Duchenne muscular dystrophy. The study of for future, not only of this boy, for future medic and doctors studies that will help the doctor community and the medicine community to understand better this Duchenne dystrophy, muscular dystrophy, and also to have the record on all the medical pages of this study that helps understand the development of this illness, and also how it is developed between the time, month, days, and years of the patient. And these are the references we use to elaborate the study.
Thank you for your attention.